Hi guys, welcome back to MHP Mental Health Piece. A specific phobia, formerly called a simple phobia, is a lasting and unreasonable fear caused by the presence or thought of a specific object or situation that usually poses little or no actual danger. Exposure to the object or situation brings about an immediate reaction, causing the person to endure intense anxiety or nervousness, or to avoid the object or situation entirely. The distress associated with the phobia and or the need to avoid the object or situation can significantly interfere with the person's ability to function. Adults with a specific phobia recognize the fear is excessive or unreasonable, yet are unable to overcome it. There are different types of specific phobias based on the object or situation feared, including animal phobias. Examples include the fear of dogs, snakes, insects, or mice. Animal phobias are the most common specific phobias. Situational phobias. These involve a fear of specific situations such as flying, riding in a car or on public transportation, driving, going over the bridges or in tunnels, or of being in a closed in place like an elevator. Natural environment phobias. Examples include the fear of storms, heights, or water. Blood injection injury phobias. These involve a fear of being injured, of seeing blood, or of invasive medical procedures such as blood tests or injections. Other phobias. These include a fear of falling down, a fear of loud sound, a fear of costumed characters such as clowns. According to the DSM 5, symptoms of specific phobias may include excessive or irrational fear of a specific object or situation. For example, the person may be scared of going out of the home because he thinks every time he keeps foot out of his house, he can be dead, so he doesn't go out and has an irrational fear with going out situations. Avoiding the object or situation or enduring it with great distress. Example, avoiding to go out for social gatherings or getting distressed out if someone asks to go out with them. Physical symptoms of anxiety or panic attacks such as pounding heart, nausea or diarrhea, sweating, trembling or shaking, numbness or tingling, problems with breathing, that is shortness of breath, feeling dizzy or lightheaded, or feeling like you're choking. For example, if someone asked you to attend a social gathering but you're very nervous about it, you are phobic of social gatherings, so you start sweating than usual because of the phobia of attending the social gathering. Anticipatory anxiety, which involves becoming nervous ahead of time about being in certain situations or coming in contact with the object of your phobia. For example, a person with a fear of dogs may become anxious about going for a walk because they may see a dog along the way. Fear can be learned from others as well. A child whose parents react with fear and anxiety to certain objects or situations is likely to also respond to those objects with fear. If symptoms of a specific phobia are present, the doctor will begin an evaluation by performing a medical and psychiatric history and may perform a brief physical exam. Although there are no lab tests to specifically diagnose specific phobia, the doctors may use various tests to make sure that a physical illness is not the cause of the symptoms. The doctor bases their diagnosis of specific phobias on reported symptoms, including any problems with functioning caused by the symptoms. A specific phobia is diagnosed if the person's fear and anxiety are particularly distressing or if they interfere with their daily routine, including school, work, social activities, and relationships. That being said, let's discuss the therapeutic techniques used to treat specific phobias. Exposure therapy. It is one of the most effective treatments for specific phobias. The technique involves gradually exposing individuals to the feared object or situations in a controlled and supportive environment. Through repeated exposure, the goal is to reduce the anxiety response and promote a sense of safety and mastery. Cognitive behavioral therapy or CBT. It is another widely used approach for treating specific phobias. It focuses on identifying and challenging irrational thoughts and beliefs related to phobia. By restructuring these cognitive patterns, individuals can develop a more adaptive and realistic thinking which can help reduce fear and anxiety. Relaxation techniques. Relaxation techniques like deep breathing exercises, progressive muscle relaxation or PMR, and mindfulness meditation can complement exposure therapy and CBT. These techniques can help individuals manage anxiety symptoms and promote a sense of calmness during exposure to the feared object or situation. Virtual reality therapy. In the recent years, virtual reality therapy has emerged as an innovative and effective tool for treating specific phobias. By using VR or virtual reality simulations, individuals can experience a controlled and immersive environment that resembles the phobic stimulus. This allows for repeated exposure and practice in a safe and controlled manner. While therapy is the primary treatment approach for specific phobias, in some cases, medication may be considered to manage associated anxiety symptoms. However, it is important to note that medication is typically not the first line treatment for specific phobias. The decision to use medication is usually made in collaboration with the individual and a qualified healthcare professional, that is, the psychiatrist and the psychologist. Selective serotonin reuptake inhibitors, SSRIs. One commonly prescribed class of medications for specific phobias are SSRIs. These medications work by increasing the availability of serotonin, a neurotransmitter that helps regulate mood. SSRIs can help reduce anxiety and alleviate the symptoms associated with specific phobias. Beta blockers. Another medication option used by psychiatrists is beta blockers. They are primarily prescribed to manage physical symptoms of anxiety, such as rapid heart rate, tremors, and sweating. By blocking the effects of adrenaline, they can help individuals better cope with the physiological manifestations of fear during the exposure to the phobic stimulus. Benzodiazepines. In some cases, psychiatrists may prescribe benzodiazepines as a short-term solution for acute anxiety symptoms related to specific phobias. These medications have a calming effect and can prescribe immediate relief. However, due to their potential dependence and side effects, benzodiazepines are typically used for short-term durations and under close supervision. That's all for today's video. If you found this information helpful, don't forget to like and subscribe us. Remember, seeking help is a courageous step towards happier and healthier life. Take care and we'll see you in the next video.
If you liked our content, like, share, subscribe, and press the bell icon to never miss an update from MHP.